You guys got any words on, because I know this time last year we were talking a lot about the H1N1 pandemic. You guys got any words on what's going on right now, 2010, with that?
Well, it's fall now, and obviously these sorts of things are going to be coming back onto the forefront. So we need to, start putting that information out there again, because basically it's the time of year. People are going to be looking for this type of information again. So we'll be picking that up as well.
Absolutely. I've heard they're going to put the H1N1 in with the regular shot. And so that's one sort of aspect of it. But the bottom line is that in France, only 6% of them took the H1N1 vaccine, whereas here in Canada, about 30% of us did. It's been exposed as a fraud, and you can only say that the French spoke to each other, shared their concerns more, got out their frustrations about what this pandemic scare was. And if we remember that, and we remember what we did, what TorontoTruthSeekers did, what PressForTruth.ca did, and what all of us did in Canada in terms of at least talking about it, and do that a little more, then we can protect ourselves against the next scare.
Loaded up the bullet and I let the piggy squill. Picking up the gripping and I shot him in the shield. With the body bag of ignorance, it's all becoming real. Media lies, don't believe the frenzy. A shortage of vaccine, we're neighborhood friendly. H1N1 is not real, it's a plan to get money and pay back bills.
Do we today know where it likely arose? Do we have a sense of the probability of where it arose?
Well, I think thinking is that it's a virus that has North American swine sequence, Asian swine sequence, human sequence, and bird sequence. So somehow the virus picked up all of these different genes. Where that happened, nobody's really sure. I think most people would guess it was in Mexico, but it could have been in California. I don't think it was in Canada. But it's really a guess, and there really isn't any good way of going back and figuring it out.
And one of the simplest explanations is that it's a laboratory escape.
This strain of swine influenza that's been cultured in the laboratory is something that's not been seen anywhere actually in the United States and the world. So this is actually a new strain of influenza that's been identified.
It wasn't in Mexico, it started in Texas. A bird and a pig got down in a pen. Started a virus that rounded the sin. That's how it begins, but is that the truth? Healthy is healthy, the lies are the...
No, this is the new needle. That's a needle? Yeah, it's going to get rid of the old needle, and this one here is 1.5 millimeters compared to the old one, which is 25 millimeters in length. So basically for people who don't like to get the needle, who are scared to get the needle, so that's what this is for, to calm people down and for children not to cry every time they get the shot. So basically, I'm thinking they could actually put a microchip in this needle and give it to you, and it goes only under the skin. That's why your shoulder hurts when you get the other one into the muscle, right? It's another ploy to get you to take the vaccine. The health people will stoop to any length to get you to take the vaccine. That's what it's all about. So we got to have a heads up on this, because we got to keep this out in the forefront right now.
Media lies, don't believe the frenzy. A shortage of vaccine, we're neighborhood friendly. H1N1 is not real, it's a plan to get money and pay back.
It was a little bit of serendipity, it was a little bit of good planning, and it was a little bit of good epi that all went into this. I had been to a conference that week and heard Steve Lindstrom from the CDC release the 2 cases of the novel swine virus in kids in California. Got back the Thursday, received information from our epi colleagues that there was a cluster of illness in a school that had contact with Mexico, and knowing that ProMed releases that there was this unusual respiratory outbreak in Mexico, we said, okay, well, we'll make sure that we subtype these viruses to make sure that it's just the seasonal influenza. And we weren't able to type them as normal seasonal influenza. So these untypable viruses is our red flag to send it on to the NML for confirmation so that they can inform the WHO. This is the chain of command, if you will, for diagnostics.
When we hear pandemic 6, does the WHO set those scales? Are they the one that says it's a 5 or it's a 6?
they make the determination that it's a 6, that basically there's a new virus that's essentially everywhere in the world.
Attaching the patterns derived in the scheme to billions of dollars for every vaccine. I saw in a dream that no one was sick. It was all in my head, a wicked ass trick. I wish that it sticks deep in the conscious before you feel woozy and start to get nauseous.
The best vaccine is no vaccine, right? So even in this, don't fear vaccines. Get your kids immunized. So all the physicians are saying to get it. So they're starting now. They're starting early. So we want to make sure that we stop it before it goes too far. So.
How many?
Well, the perception of that, obviously, the public's perception of what a pandemic is something along the lines of 1918 flu.
If you look at, this virus and affecting the young people, like the 1918 one where barracks were decimated by the flu, while older folks, they succumbed, but not at the same kinds of levels, and it has not only to do with your previous exposure, but the concentrations of people in an area, all kinds of things.
This whole issue is a matter of debate now at the World Health Organization, because other countries are concerned that there's this perception that a pandemic is means a severe disease. It doesn't. It's just the extent of geographic spread. Having said that, although there were only 400 deaths in Canada, if we hadn't had the excellent critical care that we had, if we hadn't had antivirals, if we hadn't had vaccines,
I agree with all of
there would have been a lot more, that most of the people that were admitted to ICU would have died.
I agree, but I think a lot of people did not take advantage of the vaccination, because once they realized the second stage was over, and yes, the WHO was saying pandemic 6, but people weren't dying in droves. People kind of said,
Yeah. The media lies, don't believe the frenzy. A shortage of vaccine, we're neighborhood friendly. H1N1 is not real, it's a plan to get money and make that kill. I'm paying back bills till radiation kills. You swallow propaganda like a vaccination pill. The vaccination will attack against immunity. The plan of devastation executed very beautifully. In this community, we are too intelligent. If it's so good, then give a shot to the
In light of the H1N1 pandemic, do you think the H1 pandemic is still on? What's going on here with that?
Well, actually, Health Canada and the World Health Organization, I think about a few weeks ago, considered the H1N1 flu as gone. So this flu season is going to be the regular flu season. So what they're going to do is maybe put two flus together, H1N1 mixed with the regular flu. So you don't have to get 2 shots. You'll just get one big shot, and there you go.
Attacking on the media who lie like Wikipedia. That's why I never watch the news, they're always misleading you, feeding you to fear in this greedy little year.
Well, we
tell
talk
people
about
to go and get their flu shots, be careful, wash your hands.
we talk about an epidemic
Don't talk
every year.
about it. Yeah, but we don't talk about it in the symptoms that you might die if you're
Well, it depends on who you speak to. When I give talks to healthcare professionals, and the first question I ask them, how many of you are coming to work to kill a patient today? Because if you don't get your flu shot, that's potentially what you could do.
There was a little bit of a confusion with the adjuvanted vaccine and whether that was appropriate for pregnant women.
Because we know that there is resistance to these antivirals, we have a diversified antiviral stockpile.
The immunization rate being higher and studying to see how that can be beneficial, because of course we're now planning for our next pandemic, and hopefully it's a ways off, but we never know, do we?
The testing for the detection of the virus, these rapid tests are really what needs to be sort of pushed forward. That's the sort of the holy grail of influenza diagnostics, and that'll facilitate identification of the virus in under-resourced countries as well.
The virus moves back and forth between swine and humans relatively frequently. Swine have a type of influenza virus that can infect people, and every year or so we find 1 or 2 cases of this virus in humans. Sometimes even in small children who really haven't had exposure to, even though they live on a pig farm, haven't been actually exposed to pigs, so presumably they got it from their mother or father. I think the worry is that this will potentially result in creation of a new virus, which can be of increased virulence. But the actual harm this virus does to pigs is very little, and that's why the animal industry is not very interested in doing surveillance.
A painless shot. So say no to it, because you know what happens if you get the shot, it's mercury in it.
H1N1 is not real, it's a plan to get money and pay back bills. The media lies, don't believe the frenzy, a shortage of vaccine, we're neighborhood friendly. H1N1 is not real, it's a plan to get money and make that kill.
Surveillance is the underpinning to any control or mitigation to any disease. And I was at a conference recently, Rob Webster, who was my postdoc supervisor, one of the grandfathers of influenza, said, without surveillance, we have nothing.
We heard about the collaboration with Mexico.
You consider the amount of air travelers between Mexico and Canadian destinations in the middle of, in the winter and spring. I don't think there's really anything you can do to contain it at source. But if you were able to do something, it would have to be based on a robust laboratory capacity in countries around the world.
Part of the challenge of determining where the virus came from is that the lack of surveillance in the swine populations. So when people look at the origin of a virus, they compare its genetic fingerprint with everything that we know exists in data banks. And there's a span of 10 years or so where there's no data on swine viruses circulating around. So in that 10-year period, this could have been happening in any...
Even a country like Mexico, which is a middle-income country, they weren't able to recognize that this was a novel influenza strain because of the technology they were using at the time. If they had had a different technology, they probably would have been able to find the outbreak about a month earlier, I think. They had.
And the problem is that there's not a lot of animal surveillance, and it's a challenge to get animal surveillance going.
Yeah.
The best thing to do is don't take it. So go natural, don't go synthetic. We've always mentioned this street actions here at Dundas Square.
The biggest mistake from a staging perspective is that it wasn't clarified that level 6 meant spread and not severity. And as Dr. Plummer said, that is they're looking at revising all of that.
So here's the truth.
Council of Europe will launch a probe into pharmaceutical companies accused of manipulating swine flu data. This follows a claim by a renowned German scientist that vaccine manufacturers pressured the World Health Organization into declaring a swine flu pandemic, seeking to increase profits.